So Christina.
Yes, thanks, Rebecca. So one of the most important roles a friend or family member can play for someone going through breast cancer treatment is, and the time beyond treatment, is really being a source of support. So let's hear from our patients how social support made a difference for them.
I found that there were actually a lot of support resources online for breast cancer patients, and specifically metastatic breast cancer patients. There's a lot of different Facebook groups that are private, so nobody would actually know. If you didn't want people to know, if you weren't public about your diagnosis, you can still join these groups and benefit from the wisdom of these patients, some of which have been living with metastatic disease for decades. So I was actually very hesitant to seek out support. I was really afraid to meet metastatic patients that weren't doing well. And I was doing very well. I had no evidence of disease and I was stable. And so I really kind of didn't seek out any outside support. I really just did my own type of research. But once I did, it was incredibly helpful. And I learned so much from these patients.
Having that network of family and friend support make the difference the first time and the second time I was diagnosed, because that love really gets to you and you have to feel vulnerable once in a while and somebody has to take care of you. But then, you'll get over it.
Just know that you're not alone. There is a big breast cancer community of women and men, because as we know, 1% of men get breast cancer, and there's someone out there that's willing to listen, to help. There are helplines everywhere, so yeah, just love yourself. And I love you. I don't know you, but I do. It's just this is a world. And I always say breast cancer was never about Sheila. It's about who I can serve. And that's what I want to serve, is the breast cancer community.
So Christine, Barbara, and Sheila just shared how social support made a difference for them and the importance of understanding there's a big community presence to connect with. So let's talk about support. So what is social support? So social support is the emotional support, practical help, advice, and other benefits you can get from interacting with people in your life. So social support plays a really key role in helping people work through emotional and physical challenges of breast cancer. So nobody should face breast cancer alone, but getting support is important for a person's well-being. It can help a person really cope. So social support can take many forms, and a person may need different kinds of support at different times. So support can come from co-survivors. So at Komen, we consider a person a survivor from the moment a breast cancer diagnosis is confirmed. So co-survivors can really be all the people we talked about earlier in your healthcare team. So family members, spouses or partners, healthcare providers, colleagues, anybody really who is there to lend a hand from diagnosis through treatment and beyond. So social support can take many kinds of forms. It can be just listening to somebody, or a formal support group, or a therapist. So it can come from even practical help. So people can, help drive you from treatments, to and from treatment, help with cleaning, grocery shopping, childcare. And we actually have a page on Komen.org for co-survivors that contain printable and easily understood information about breast cancer, tips on what to say, and stories and links to other sources of information. So we just talked about, where to find support, but there's actually benefits of social support. So there's actually evidence that shows social support may impact a person's quality of life. So for example, patients may see reduction in anxiety or psychological distress, depression, fatigue, and even pain. So just think about that. Just being a friend to someone undergoing breast cancer treatment can reduce their perception of pain. Social support can also improve mood, self-image, the ability to cope, sexual satisfaction, and feelings of control. So co-survivors, including your healthcare team, are very important for people going through breast cancer. And the other thing to remember is that breast cancer just doesn't affect only the person with diagnosis, really the family. It's a family disease. So children and sons and daughters and brothers and sisters all are affected and may also need some support. So Rebecca, I'll let you take this one over.
Yeah, I think it's really important to remember to take care of yourself. You can accept your fears, but then try to let them go. You need to do what you need to do to stay healthy and be you. And it's really important to spend some peaceful time every day. Sometimes that's, for me, it was running. Some people want to do, spending time with their grandkids. And then I always throw out there, maybe spending time underwater basket weaving is your thing. So just remember to take care of you, and remember that cancer doesn't have you. You have cancer. It's also really important to maybe have a script or something of how people, how you can tell people how they can help you. It's really hard because when I was diagnosed with cancer, I found people were relying on me to tell them how they could help. And it became a little overwhelming. So having some thoughts of how people could help you will be really helpful. So, they may ask you if you need groceries, or doing some laundry, or figuring out medical bills, or even today with the COVID stuff going on, getting a ride to treatment is important. So kind of knowing what that is ahead of time will help your network. I know it sounds weird that, you need to come up with a list, but it'll also help you manage some of the expectations around when your friends come around for assistance.
Thanks, Rebecca. So I just really quickly, I wanted to make sure that I talk about some of our educational resources that may be actually helpful for you. So I talked earlier about the breast cancer section of Komen.org. It's actually developed and Anne alluded to this earlier, in partnership with Harvard Medical School faculty and Dana-Farber Cancer Institute staff. So the information on our site comes from research studies done in people, which are published in reputable peer-reviewed journals. So our content is always in review. And there's so many pages of facts and information about breast cancer on our site. So I invite you to visit Komen.org. There are videos, interactive features, charts and graphs, and all of our downloadable resources are available. And we have at least one educational resource in over 40 languages. So two other really important resources that we have are our Komen Breast Care Helpline and Komen Clinical Trial Information Helpline. So these helplines have trained staff and oncology social workers that are available to answer questions and provide psychosocial support and information about local and national resources. In addition, the staff provides information and coaching support during the decision-making process about clinical trial enrollment. So the helpline's open between 9 a.m. and 10 p.m. Eastern Time and are available in English and Spanish. The last resource is our treatment assistance program, which is for patients to help address financial barriers, which may be preventing them from completing treatment. So this program provides funding for things like transportation to and from treatment, food, childcare, oral pain medication, oral chemotherapy. So you can get more information for yourself or for your family just by calling our Komen Breast Care Helpline. So I'll pass it back over to Anne.
Thanks. Very, very helpful. Rebecca, where did you find your social support, and how did that help you through diagnosis and treatment?
So my oncologist was very well connected, and she actually suggested, after I told her some of my concerns and worries, she actually suggested that I go to a support group with the Young Survivor Coalition. It was an in-person group that met biweekly, and there I met these two wonderful women who had been through what I was about to go through. And I wasn't a big talker. I didn't actually even think a support group was right for me. But after meeting these two women and the support that they showed me, it was really helpful. You know, this is a club that no one wants to be a part of, but once you're part of this group, the amount of people who have been through breast cancer are really helpful in offering support and guidance on how to deal with certain things in their life. So
very cool. Very, very cool.
So we also have a few questions from our audience. So Anne or Christina, my husband has breast cancer. Where can he find resources for men?
Sure, I can take this one, Anne. You can, if you have anything additional. So we have a few resources for men. We have the page on, which is Breast Cancer in Men, on the About Breast Cancer section of Komen.org. We also have a downloadable resource called Men Can Get Breast Cancer Too. And then we actually recently hosted a webinar on breast cancer in men. And the other thing that's really neat is our Komen Breast Care Helpline, which I just mentioned, actually offers a free telephone support group for men with breast cancer. So these groups can provide a safe place for men to discuss the challenges of breast cancer, get information, and exchange support.
Well, that's great. I'd send people to the NCI website, and I don't think there are any separate advocacy groups that focus on men in particular. We've had support groups and things in the past, but the numbers are so relatively few. Although, increasingly we're having more and more survivors who are men, so that's and they can team up. But I think Komen's a great place to go for that.
And lastly, Christina, what about virtual support groups?
Sure. So, in COVID times, these are so important. So a lot of different organizations provide online support groups. So they're very similar to in-person support groups. They provide a chance to share information and give and receive support, just gain a sense of empowerment. Christine mentioned in her video earlier that Komen offers a closed Facebook group. So it's called the Komen Breast Cancer Group. So the Facebook group provides a place where they can get connected to other people, discuss each other's experience, and build strong relationships to support each other. So if you visit Facebook and search for Komen Breast Cancer Group, you can request and join the closed group. We actually also provide links to other organizations on our website who may provide virtual online support groups. I think Cancer Care does provide these services as well.
Great. Thank you so much.
So in this segment, let's hear a little more about Rebecca's breast cancer story and the role she takes in her care. Rebecca?
Yeah. Thanks. So I know I've alluded to this earlier on, but I'm a runner. And in 2010, I had decided to make a goal for myself to do an event every month, whether it be a marathon or half marathon or a long distance bike ride. I wanted to maybe even attempt a triathlon. So I was on track for that, accomplishing that goal. I had done a half marathon in January. I had actually traveled to Jacksonville, Florida to do a race in Jacksonville. And lo and behold, it was actually a breast cancer race. I didn't even know it. I was very much an introvert at the time. And at the starting line, an older couple who had been running the race for many years started chatting with me. And at the end, it turned out that we finished about the same time. And that's when I realized that the woman was wearing a survivor shirt. And I said, I don't know many survivors. What's your secret? How'd you do it? And she said, I ran every day. And I thought, well, if I ever get diagnosed, I'm going to do the same. 3 months later, still on track for my goal, I heard those words, you have cancer. And I just thought about that woman. I thought, well, if she did it, then I can do it too. So as they always do, they seem to call you on a Friday afternoon and tell you that you have cancer. And by the way, don't Google anything over the weekend. I did not follow those rules. I did a lot of research over the weekend. And when I met with my surgeon on Monday, he basically said, no, you're not going to be able to accomplish your goals. I don't advise you to run, and we're going to get you in surgery on this Friday, and then we're going to start you with we're going to hit you with everything. And I talked about reconstruction, and he said, no, you will worry about that later. And I just thought, I'm 35. I don't want to be deformed or mutilated, or I didn't want to be broken down. And so when I did tell him about my running goals, he goes, I'm going to save your life so you can run. And I just thought, we do not have the same goals in mind. So I went somewhere else. And luckily enough, I found someone who actually, while she didn't always agree with my plan to run and such during treatment, she definitely supported me. And at the end of 2010, I did actually accomplish my goal, plus survive breast cancer. So I even ran a marathon during chemo and 2 half marathons. Not that I'm recommending anyone start that during treatment, but the exercise definitely helped. And 10 years later, I'm still running. I'm still focused on staying healthy and trying to maintain a healthy lifestyle.
Wow, what an amazing story, Rebecca. And congratulations on teaching your oncologists. I learn all the time from my patients, and what I think I couldn't do, I watch them do. So that's impressive. You know, Rebecca obviously just showed how she advocated for herself. Let's hear Sheila, Christine, and Barbara's experience around educating themselves and asking questions and pushing back sometimes, understanding that, you know, the patient's opinion matters. And we've all learned the hard way as doctors that I can tell you to do something, and if you disagree with me, you're probably not going to do it. So the reality of that is, you know, we have to meet patients where they are, convince them. And if we can't convince them of something that we think they should do, we should work harder to better understand them and where they're coming from so they can make their best treatments. But let's hear from our patients.
And I didn't know that there were support groups. I never knew Black women could get breast cancer, except my mom, because that's the only person I knew as a Black woman that got breast cancer. So I'm like, I got to educate myself. I need to educate myself about everything, you know. And I did, and I just started researching. And luckily, my breast surgeon took an interest in me, and they had this conference downtown St. Louis. She sent me the flyer. She said, Sheila, I think this would be a great fit for you. And that's how my advocacy started. And that's when I started asking more questions and, you know, what should I do about this? And what is Herceptin? You know, just different things. And I just took an active role in my care. And, you know, I just say, be your own advocate. You know, if you don't feel something is right, it's not right.
To see your doctor as your partner in this. They also want you to live a long time, and they want you to live a good quality of life. So I think that, you know, it's important to recognize that you're both peers. You're an expert as a patient, and they're an expert in treating cancer, but your opinion matters just as much. And I think it's very important that if you don't feel comfortable with your oncologist, if you don't have that relationship with your oncologist, I recommend getting a second opinion. I really think it can be a major difference for patients to hear a perspective from a different oncologist. And sometimes you just get a better energy from somebody, and the more you trust and have confidence in your doctor, the better results you're going to have.
When you're sitting there with the physician, you will forget. So what I did every time during the day or something, I had a question, I didn't have my phone in that time, but I would write it down. And when we went to the doctor, I will ask all my questions. So I think that is very important, to have a diary, to write down your questions, and to really ask, you know, side effects, how can I imagine, who can I call when I feel that way, what can I do in my normal life, because sometimes you think because you're on chemo, you cannot do other things. So I think it's important, you know, what can I do? And they will tell you usually that you can do your normal things. Now, you know, depending on what's happening in the outside world, well, you might have to be more careful than others, but it's really having that conversation, and they have the experience and the amount of patience to really understand how you could feel.
So how important is reaching out for resources, asking questions, and keeping in communication with the team? Let's hear again from our patients.
There's a lot of resources available. There's a lot of great nonprofit organizations that have information. At the time I was diagnosed, one of the first one I went to was American Cancer Society, then Susan G. Komen, because here in Puerto Rico we had a local affiliate. So I was able to get information from them. In terms of Hispanics, I think there's a lack of information, and there's still a lot of organizations. Susan Komen has many or all of their educational pieces both in English and in Spanish, and sometimes patients don't know that. And I think it's important as a patient to reach out for that information. And for Hispanic, for example, it's a cultural thing that you kind of rely on what the physician is going to say. But I would encourage patients to really be prepared. And you can discuss and rely on what the physician is saying, but it's it's good also to ask questions.
I actually did most of my communication through MyChart. So I was just trying to use technology, and I found that it was actually faster. I would get faster responses. And, it was very important for me to tell them when I, had pain, when I was nauseous, and to not feel like I was complaining. And luckily they were very receptive to that. And a lot of times they were able to give me some kind of medication or intervention to manage that symptom.
If something don't feel right, then please tell your doctor. You're having a side effect that's weird, call your doctor. If you just not feeling good for that day and vomiting, call your doctor, because they got medicines for everything. Right now, my doctor just put me on Eman for nausea, and it's working pretty good, So, just got to ask a lot of questions, and just, like I said, be your own advocate. And there's no right or wrong answer to cancer.
All right, so we have a few final questions from our audience. So Ann and Rebecca, so the question is, do I and my daughters need genetic testing, and does that depend on my type? Ann, do you want to go first?
Sure, that's an interesting and evolving question. So we used to say your daughters only need testing if you tested positive for a gene, or you didn't get tested, but there was a suspicion, or if your partner, your daughter's father or mother, assuming it's a woman talking about this, then if the father had a strong family predisposition, then genetic testing might be considered. Because remember, the genetics can come through the father, 50-50. And we used to say it was type independent. Nowadays, we've changed that. And if a woman, and it's all about the family history and her testing, but nowadays, if a woman has triple negative breast cancer in particular, we are more likely to want her to get tested. And then, of course, it will still depend on what that woman had. Sometimes people don't know their family history. And then it depends on their personal history. And people these days, we're erring on the side of testing more and more people. In fact, some are calling for population-based testing, but that has a lot of implications for how we manage information and false negatives and things like that. But I hope that answered your question.
Yeah, and Rebecca, you mentioned earlier about having the BRCA2 mutation. So can you tell us a little bit about that?
Sure. So I had actually, my family was very open in talking about, we had cancer in our family, but we never talked about the specifics of when it happened to us or how it happened. And so when I was diagnosed with breast cancer and got the genetic testing, I found out, I started asking more questions in my family. It turned out my aunt and grandmother had passed away at 34 from breast cancer, but that was also during a time where we didn't talk about breast cancer very much. The other thing is I had brought my family history up to my gynecologist, and when I found the lump, and when I told her that, I had mentioned it was on my father's side and my dad had passed away from prostate cancer, she said that didn't bother her. And so when I did get the testing done, as it turned out, the BRCA mutation comes from my father's side. So I think what Ann said, it can come from either your mother or your father's side. Just knowing that is really helpful.
Yes, and I think that's you brought up a good point about the BRCA2 mutation, being related to prostate cancer on the male side of the family. So it's important for men who do have prostate cancer to, talk to their sons as well. So I think that's really important. And one final question, is there a higher risk of lymphedema after all treatment?
No, a higher risk of lymphedema is associated with the extent of axillary treatment, meaning how much surgery is done there, whether or not radiation is given, and a person's body mass and some other risk factors. But generally not all treatments. A little more with chemo maybe, but not so clear. But it's really about the extent of axillary surgery and radiation.
Okay, sounds good. Dr. Partridge, I'll pass this slide back over to you.
Yeah, so it's important, I think, to note that there are a lot of resources available to download on some key questions to ask different members of your healthcare team. We have them for you as well, and links to resources to find more information and support. This is available for download in the event resources section of the player located under the video box, left bottom window of your screen. Well, thank you again, Rebecca and Christina, and to all our patient speakers, Barbara, Sheila, and Christine, for providing us with a very informative discussion. You can hear their full patient stories in the event resources section of the player located under the video box, together with other resources and a downloadable version of today's presentation slides. Thank you to our audience for joining us for this special patient education program. We're pleased to have been able to provide some answers to many of your thoughtful and important questions. Support for this patient education program was provided by an educational grant from Daiichi Sankyo Incorporated, Seattle Genetics Incorporated, and an independent educational grant from AstraZeneca. Please remember to complete the questions at the end of the program to help reinforce some of the topics we covered today. Again, my name is Dr. Ann Partridge, and thank you for joining us.